CBC is your red and white blood cell count, but it's also talking a lot about what type of white blood cells you have and what's going on about your red blood cells, not just how many you have, right? So a CBC is going to tell you the count of your white blood cells. And if your white blood cell count is low, then that is suggestive of a little bit of a weak constitution, a weak body, right? So you haven't been eating enough food, so you're not getting your nutrients in. So there's a lot of reasons why you could have a low white blood cell count. Now, you could have a high white blood cell count if you have a current acute infection, something causing sepsis, something that could cause you to pass away or die from. So that is a acute infection. Now, what about red blood cell count? So red blood cell count can go up and down for a number of different reasons, but low red blood cell count is likely that you're bleeding somewhere. So you can have Crohn's or ulcerative colitis, you can have some small tears in your digestive tract where you're bleeding out. Now, I've seen people come into my clinic who've had to get transfusions over and over and over, and they're always losing blood, but yet doctors haven't been able to figure out why. Well, there's usually a few main reasons why, especially for the people that are in this group, which is chronic infections are going to cause all kinds of blood loss. There's also infections out there that cause the die-off of red blood cells. So if you have a chronic anemia of specifically red blood cells, then likely you've got some sort of organisms that are creating immune reactions, leading to potentially some sort of leak of blood out of your gut, or an infection that's causing the die-off of red blood cells. Now, there's a lot of other types of anemia. Anemia isn't just simply to red blood cells. So what happens if you have an anemia to, say, B vitamins, right? So you have low B vitamins, which is going to cause your red blood cell size to change. So if you have anemia to B vitamins, your cells get bigger. Iron, they get smaller. So when you're looking at your CBC and you see MCH, MCV, MCHC, these are size measurements of your red blood cell. And if they're large, if those numbers go up high, then you likely have a B vitamin deficiency. And if they're low, then you likely have an iron deficiency. Not perfectly, because there are diseases out there like thalassemia and other blood disorders that do change the size of your red blood cells. But these are a few things to look out for. Is B vitamin or iron are going to change those numbers there. Now, there's some other things going on. Like, for instance, your red blood cell distribution width is going to be how big your cell is. And if it gets really big, then you likely, again, have a couple of reasons for that. Really big red blood cell distribution width could be a B vitamin issue. It also could be that your red blood cells are dying off so quickly that you're pulling your immature or young red blood cells out of your bone marrow, and you're putting them into your blood. So that makes your cells bigger, because immature red blood cells are big. Mature red blood cells are smaller. So then if it's too small in red blood cell distribution width, which is RDW on your CBC, it's going to tell us that maybe we have an iron deficiency. So I'm just going through a few of these CBC things because all of you have had a CBC out there, and all of you probably could look back at it and go, are there some details here that can help me understand what's going on in my body? Now, one of my favorite things to look for is actually looking at white blood cell and looking at the differentials of those white blood cells, meaning what kind do you have? Do you have a lot of neutrophils, which is a type of white blood cell that attacks at bacteria? Or do you have an elevated amount of lymphocytes, which is a type of white blood cell that was more targeted toward viruses? Now, looking at these gives us a lot of facts. Look at eosinophils, that elevates when you have food allergies and parasites. And I've also seen some correlation out there with monocytes and that number being elevated for parasites along with that. So if you look down at that differential on your CBC and the neutrophils say 60, it's right on the money. But if your neutrophils are elevated to say 70, think about the potential of having a bacterial infection. Now, this could be more acute, but this is something just to look at. Remember, everything I'm saying is hints at what will help you to understand your own situation. Now, if you look at your neutrophils and they're low, so they're 30, and your lymphocytes are elevated above their normal 30, they're up in the 40, 50, 60 range, then you're thinking at that point, nope, not viruses. That's what I've said before. But in that case, that means potentially autoimmunity, or you're looking at inflammation. So for a lot of PANS kids, a lot of people that have these chronic infections that have created autoimmunity, you actually increase up to the point where you have a lot more chance for having lymphocytes way up, right? So your lymphocytes are way above neutrophils. So that means look at the autoimmunity inflammation piece. Now, monocytes and your eosinophils are much lower in numbers. So if your eosinophils should be below 5, if it is above 5, or then you're starting to think there's something might be going on. But if it's above 7, you have either a parasite or a chronic allergen going on in your body right then. And in my many cases with people that have, typically that's not triggering the eosinophil, it's the parasites in the body that are. So be really careful when you're looking at these numbers, and you can't take them to the bank because they're not perfect. They are percentages, and white blood cell counts can go up and down, but they definitely give you a bunch of information to check out. So that is the CBC right there. There are a few other pieces of information in there, like hemoglobin. Hemoglobin is always low when you have a deficiency of iron. It can be low when you've had a bleeding incident or when you're bleeding out because there's not enough iron because you're losing it. So just take a look at your CBC and take that information in and start looking at these things to understand how you and your body work and compare them over time, right? So I've had people come in where we've seen this elevated neutrophil, elevated, and I'm going, you probably have had a bacterial infection. I'm like, oh yeah, I have Lyme, or I have Bartonella, or maybe their test isn't coming back positive, but it's something that you can use to help yourself. So, and this is just the CBC, right? So this is just one of the most routine tests out there. Imagine if you take the CBC and then add that to all of these other information, all the other information. So you add it to a CMP, which has a ton more information in it, which is also a routine test always run, which we'll be going over as we, and we'll be continuing through it. So hopefully this gives you a couple of ideas, a couple of things to think about while you're moving through, looking at your labs, trying to figure out what is causing all these symptoms in you when your doctors keep telling you your blood work looks perfect. But is it really perfect? Or is it just that they're looking at it for that acute, life-threatening situation, whereas I'm looking at it for what is causing you not to feel well? All right, guys. If you know people that have blood work, that have been searching for answers, that can't find answers, invite them to this. Tag them to this video. Invite them in our group so that they can learn too, so that we can continue helping everybody to find hope, so that we can find healing, so that we all can feel better.